Inflammatory bowel disease. I want to give you a possible easy solution. Now, what is inflammatory bowel disease? It's a chronic inflammatory condition of the intestines that causes abdominal pain, diarrhea, weight loss, and two common forms are Crohn's disease and ulcerative colitis. Now, Rhonda had this problem for years and couldn't go out with her girlfriends because of this problem. And in 90 days, it was gone with the 7 systems plan. I had another patient with ulcerative colitis. He was a pilot. You guys know what ulcerative colitis looks like? Now you do. It's a nasty ulcerative problem of the colon. And you can imagine as a pilot, this is not a good thing to have. After 30 days of doing the things that we talked to him about, it was in remission, and it's been in remission for 4 years now. So this problem is frequently triggered by environmental factors. There may be a little bit of a genetic tendency, but mostly it's something you're doing. And where is it more common? Well, this was interesting when they started looking at the geographical areas where this occurred, and they found that it occurred in the northern latitudes. What are you thinking, class? A disease mostly in the northern latitudes? Very good, and that's what they did. They said, well, there must be less sunlight and less vitamin D causing this. So further investigation showed that higher D status frequently meant less surgery for Crohn's. So here's a study where they put people on 1,000 IUs of D per day. Now that's a fairly low dose, and they saw a slight improvement, but after 12 months, not so much. So another study, 1,200 IUs per day, and relapses for Crohn's, or recurring severe bouts, were cut in half on that dose. So another study up to 2,000 per day, and what did they find? Significant improvement in leaky gut. And leaky gut is a real and serious problem. It causes all kinds of things. Vitamin D is proven to help that. And they found that when your blood levels reached 75, and that's what they should be if you're taking vitamin D, you want to have a blood test to make sure it gets up to about 70, inflammation disappeared. So 5,000 IU per day study. What did they find? Significant drop in disease and increased quality of life. The majority of patients achieved remission of their problem. All but one had remarkable results, and this is just taking vitamin D. And vitamin D at 5,000 is very well tolerated, and it could be that even a little higher dose may be normal. They say the physiological zone is between 75 and 200. Now personally, I don't think you should be over 100, but 75 is really good. When they looked back at people who were in the agricultural cradle of mankind back in the day, they figured their vitamin D was probably 115 because of working outside and exposure to sun. So I want to encourage you to have a vitamin D test every year if you have not. Take vitamin D3, and most people require about 5,000 IU per day to get to an adequate level. And if you've enjoyed this video, please hit the share button so your friends can see it.